Well, COVID-19 continues to have a disproportionately high impact on Toronto's Black and other racialized communities.
A new task force, which includes many of Canada's top Black scientists, is meeting tonight to discuss vaccine distribution.
Dr. Zainab Abdurrahman is the allergy lead at the Special Immunization Clinic at McMaster University, and David Burt is an immunologist with more than 30 years of experience in vaccine development. Both are part of the task force and join us tonight. And we should point out you're joining us right after one of your last town halls wrapped up. I want to know, how did tonight go, and what are the recurring themes, Dr. Abdurrahman, that you keep hearing day in and day out?
So firstly, thank you for having us and addressing this topic. One of I think the biggest themes that we've seen coming up over and over is just the thought that people didn't have a place to ask questions. So a lot of thankfulness has come forward just in terms of having a place to ask questions. People wanting to know about how the studies were conducted, were all the studies conducted, and they wanted to know about efficacy and if there was diversity in the studies to ensure that they were adequately represented in the studies, to ensure that it would work in them personally in terms of being Black. And that was also addressed in terms of nearly 10% of the people in the studies being identifying as being Black. And I think also just addressing some of the concerns about vaccination on a wide scale, talking about previous distrust that has arisen from previous, trials such as, Tuskegee and other kind of lived Black experiences that have been negative with big kind of rollouts from the health sector. So trying to ensure that we can give the information and explain, that it is safe in the population.
Yeah, can we talk more about those concerns, Dr. Burt? Do you have examples of vaccine hesitancy and what's driving that among Black communities?
Yeah, as Dr. Zainab said, it's clearly a lot of people in our community look back at historical medical situations where Blacks have been targeted and haven't been given the necessary medicines that they need. And the Tuskegee incident always comes up, even though it's an American one. And people have real experiences even now where they don't feel that they have access to good health care. And so one of the things that we do, because we're from the same community and we think we have an element of trust with our community, one of the things we do is to acknowledge that these things have happened, and also to try and speak to them in a scientific way because of our expertise, but in a culturally sensitive manner as well.
How much more difficult is your job being made by the overwhelming amount of information and in some cases misinformation that is out there, whether it's online, Facebook, social media or something? You see all that information, you're there trying to sort of correct the record, trying to reassure people, trying to encourage people to get vaccinated, but you're up against a tidal wave in some cases of A, historic anti-Black racism, and B, misinformation that's out there.
Yes, it is very difficult, but, it's a challenge that, we wanted to take on, and that's why we're doing so many of these town halls at different times, allowing long periods of time as well for people to ask lots of questions, and specifically, having ones that we address things like conspiracy theories and misconceptions, because we're aware that these are out there. And we want to have a place where people can ask, listen, I saw this on the internet, or I read this on a WhatsApp group. Is this correct? Is this true? So we're taking that, opportunity to provide it in a safe space where they feel that they can ask any questions. And also we sometimes bring up, what we've seen, what we've read. We talk about the previous, we talk about systemic racism and anti-Black racism and how that has affected the delivery of healthcare, and how, we had issues even with COVID to start in our Black populations, not recognizing that we needed more testing centers in those areas, and how that may already have colored the experience towards healthcare in this pandemic already. So I think it's important to address and acknowledge that these different shortcomings have happened, as well as the previous transgressions. So that's one of the things that we're very open about, is that we are aware of these issues and we're coming forward because we don't want, this misinformation out there to potentially then cause the Black population to be further behind in not getting the vaccine. So we're trying our best to kind of be open and really allow a safe space for people to ask questions and hopefully get the best information, and then be able to make an informed decision and provide informed consent to get the vaccine.
Well, Dr. Abdurrahman, I wonder if, when we hear that Black communities, Black people are disproportionately impacted by COVID-19 here in Toronto, that's why the city is putting this much money into this task force. Are we championing this enough for them?
Well, the thing is, this is one aspect, but we're hoping that this will actually continue in terms of more than just the vaccine. This is one area that we're targeting, but we're hoping that with continued, leadership and advocacy, that we're going to continue in terms of, dealing with the other issues. The reasons why some of our Black populations are at higher risk have to do with social determinants of health in terms of access to health care, lots of comorbidities, also related to access to healthy foods or other issues. So we're hoping that, yes, we're working on the vaccine, but we're hoping that this will continue in terms of further advocacy and further work to be done to support our community health systems, to help provide the best care and allow us to continue in terms of healthcare for the Black population, not just the vaccine, but moving forward. Mm-hmm. So really creating long-lasting partnerships.
Okay, Dr. Zainab Abdurrahman.
I think that's one of the messages, one of the comments that we've had from the town halls, because we do surveys before, during, and after the town hall. And one of the sentiments was that our community needs this type of webinar continuing, not just for COVID, but for other health issues that affect our community specifically.
Yeah, David Burt and Dr. Zainab Abdurrahman, we have to leave it there. But as you say, the conversation continues. We hope to have you back on again to keep discussing this. Thank you both for your time tonight.
Thank you.
Thank you.
Thank you.